Everyone, welcome back to Manufacturing Hub. If you guys are watching us live, this is a special Manufacturing Hub ProveIt edition on Thursday. I'm so used to saying welcome back to Wednesdays as I did yesterday during our normal time. I had to go. I had to go at it myself in there. If you guys are watching, welcome. Super happy to go ahead and have you in. If you're new to Manufacturing Hub, welcome. If you guys have been here before on our normal Wednesday afternoon times, or if you've seen our clips, or you've watched us in podcast or other form, absolutely welcome in and thank you guys for coming back. Before we go ahead and jump into the ProveIt session, I'm going to give everyone kind of the quick overview of Manufacturing Hub so you guys know who we are as we introduce Amy to go ahead and talk. My name is Dave Griffith. My co-host up here is Vlad Romanov. Vlad, wave, smile, thank you. Every week, we go and have conversations with other practitioners in the industrial automation and manufacturing space. Every month we pick a topic, which we call a theme, and we have 3 or 4 conversations around that. This month we're talking all about technology modernization, which just so happens to coincide with ProveIt 2026. And we're going to see a lot of crazy technology modernization in about 10 days of time. So everyone, welcome in. If you guys have questions or thoughts, either for Amy or Vlad or myself, on anything or on ProveIt or on Enterprise C, as we're going to go talk about in just a minute, please go ahead and ask. We love to have kind of that interaction. That is the best part of the conversations. Otherwise, Vlad and I are just going to go ahead and monologue. And I'm not sure any longtime listener wants that. Having said that, and without further ado, everyone officially welcome to Manufacturing Hub. This is episode 247. Today, we've got our special guest, Amy Williams, back, and Amy is going to talk all about Enterprise C, which is the life sciences enterprise at the ProveIt Conference 2026. Amy, thank you so much for coming back.
Absolutely. Thank you for having me.
Yeah, thank you so much for taking the time, Amy. Really appreciate it. You have a very interesting background and I guess some interesting ties on the ProveIt side that I think make you very uniquely positioned to have this conversation. But before we get into the factory itself, could you give us an overview of your background, please?
Sure thing. So I have spent, gosh, time flies. It's been like 8 years. I work exclusively in life science manufacturing. When I first started, I was doing specifically DeltaV automation, so all about batch pharma. Then recently, over the past few years, I've kind of transitioned into more of this like digital transformation space where we're interested in building these, open architectures, start messing more with like data to hopefully try to find ways to manufacture medicines more efficiently and hopefully for less.
Awesome. And I guess in order to maybe build some foundation for those that have not heard about ProveIt and obviously the conference that is to come in a little over a week, could you give some context of your involvement last year, maybe paint a brief picture on that side before we dive into Enterprise C?
Yeah, sure. So last year, I was lucky enough to be an MC for ProveIt. So I got to help with introducing and kind of governing the ProveIt sessions. I also was, I'm affiliated with a company called Skellig, and we actually participated in the ProveIt Challenge ourselves last year, which is really great. This year, what's different, though, is we actually helped with building one of the virtual factories, Enterprise C, which is what we're going to be talking about today.
And let me, I guess, expand a little bit more on that context, right? So when we talk about a virtual factory, in this case, it is basically contained in a UNS. So for those who may not be familiar with that concept, could you maybe paint us a picture of what a UNS generally represents? And maybe, like I said, before we get into the actual facility, what kind of a role does it play in a general life sciences application?
Yeah, well, gosh, okay, I could probably go on for like an hour over what is a UNS, but yes, let's try and keep it short and sweet. So the simplest definition is a unified namespace is an edge-driven architecture that is supposed to be the real-time state of your business. So this year for ProveIt, and like ProveIt last year, the main protocol for that data is MQTT. So the easiest way to think of it is hopefully you can go to an MQTT broker and kind of see all of your real-time business data there in a way that is, I would say, a semantic hierarchy, a way that any person can look at it and kind of understand what's happening. like that's the short and sweetest oversimplification. I'm sure, you know, people can go, there's the many different ways to do a UNS. There's no one right way or wrong way, but when we're talking about ProveIt, that's more or less, I would say, like the gist of it.
Yeah, and of course, as you said, we can probably have a very long conversation just on that side, right? But my understanding, the current standing of Enterprise C is that it is basically broadcasting data that is going to be relevant for that specific facility. Could you give us like an overview, like in general, what could one expect to see in terms of that data? Again,
Oh,
I
yeah.
would say at a higher level, because we can drill down and spend a
Yeah.
lot of time like figuring that out. But just at a higher level for a business of that side, what would you
Yeah.
expect to see?
Yeah, so Enterprise C, like the high level overview of it is it's a fictional facility called Point 3 Therapeutics. And that's a play on words because it's very much, I would say, an Industry 3.0 facility. It is a fictional biotech startup. It's producing an enzyme through a batch fed fermentation process. So, what you're going to be seeing in the UNS, in this case, in the MQTT broker, is real time batch data for 4 pieces of single-use equipment. We have single-use bioreactor, single-use mixer, chrome skid, TFF skid. What we have built is 4 complete batches. So it's about 4 weeks of data, and it's publishing at 1-second resolutions into that broker. So that's kind of the UNS that was built for the vendors to then build solutions on top of.
I've got many follow-ups, and I really appreciate it. Let me pass the mic to Dave for just a moment before I keep bombarding you with some questions. But it's super interesting. Thank you.
Absolutely no. So I guess first and foremost, I think we should commend you for all of the hard work that went into creating this and creating the data. I know that there are forms and a whole bunch of operator sheets and other things that we'll get into a little bit later. I don't even want to know the amount of work it took, but I'm super excited to go see how people have taken Enterprise C and are going to go extrapolate onto that on the ProveIt side. And it's my understanding that there's going to be a lot of life sciences groups who are going to be at ProveIt. And so I'm excited to go watch as that grows and continues. Before we go dive into Enterprise C, you did a really good job of describing what a UNS, a unified namespace, was. But in large part and partially based upon our conversations, Amy, a UNS as its overall concept doesn't necessarily always translate one-to-one within life sciences. There's some massaging and other items in there. So can you help maybe all of us understand a little bit more how someone creates a UNS for life sciences, please?
Okay, sure. Yeah, so I think that, so if you're talking about like how does someone actually go about it, right? And I feel like in order to do that, you kind of need to answer a different question first, which is why build it in the first place? Because something that's a little tricky, I think, for people to understand is that like data in an MQTT broker, just data being somewhere in itself, I don't think intrinsically has any real value. Hopefully that data access is actually serving a purpose, right? So when when I'm working on Skellig, when we're trying to build these UNSs, what we're really trying to do is solve a problem. And that kind of varies a lot depending, because life sciences is a big umbrella term. I think it varies a lot from where you're starting. So when I say UNS for life science, usually what we're thinking is, okay, we're trying to build some kind of solution that's focused on data that serves some kind of need. In life sciences, we are batch driven. We have a lot of regulatory requirements. So a lot of it is, okay, how do we get data that went into this batch in a way that's accessible, that's contextualized, such that we can tell a good, compelling story about quality and compliance. But the use cases, again, vary a lot depending on what angle of life sciences you're coming from. Because if it is like, let's say you're pharma and you're just trying to crank out the same mass amount, you have the best drug ever, and you just want a ton of it. Okay, that's a completely different type of use case that you're trying to solve for versus maybe you're in R&D and you need to find a way to do things more flexibly. There's less regulation. then those use cases are going to be different. But the common theme to all of those different use cases is usually data's involved. And what's the means of getting that data to move around? And what's the means of making sure that that data is as usable to as many different people? And as we talk, as I'm sure we'll see at ProveIt, even AI, how do we set up that infrastructure? I don't know if that's what you're going at for.
Absolutely. So do you imagine we're going to see a lot of the UNSs set up similarly from the vendors? Do you imagine that there's going to be an interesting variation and there'll be questions as to why groups set up the UNS in this way on the life sciences side?
Mm-hmm.
Okay.
I bet you we're going to see a lot of different things. That's my suspicion. Because this is honestly a bigger commentary on UNS in general. So UNS, I think everybody likes the idea, let's model our data. But every time it's like, okay, but how do I actually do it, right? And I have a feeling I know this, right? The answer is a lot of people always tend to go about it a different way. So I'm really curious to see how the vendors go about it, especially for the ones dealing with historical data. There are always different approaches to how to tackle that problem. But this kind of ties into something new about ProveIt also this year. I don't know if people have heard, but there's this new requirement this year that if you're dealing with the OT data, you have to use something called the SM profile from SESB. And basically that's a push to say, let's stop reinventing the wheel over and over and over again. If you're going to make a data model for something like, I don't know, a valve, okay, make that public. And one way you could do that is make that as a SM profile that then other people can go look at. Or you say, I'm actually going to browse the existing profiles and pick one that already exists. And now we have at least some standardization, some reduction in reinventing the wheel across like industry.
Let me maybe, I do want to ask you a follow-up question, but I'll also note to ask a few things about the SESMI profiles. But I guess to take a step back, right? So for an end user, the true value, as I heard you mention, is obviously quality, compliance, and I would say process optimization, correct? Are those like the three main reasons as to how you would expect to leverage the data? And is that what you would expect to see at ProveIt in the, I would say, like in the grand scheme of things?
Yeah, I think for Enterprise C, I'm guessing we're going to have a lot of stuff that has to do probably with electronic batch records, things focused on, quality, especially because in our simulation, we have multiple runs. So I would expect to see analytics to kind of help you gear towards that like golden batch. Like, how do you make sure you're doing the same thing every time? If something's deviating, can we use data to predict a failure before it happens, right? I think those are really common use cases.
Interesting. And I guess as a follow-up to that, and as we dive into the actual Enterprise C sort of architecture, there was a question in the chat just to review the I guess the components of the facility, but I'm curious to understand a little bit more on the process side, right? Maybe having not spent as much time as you have in a life sciences facility, just want to understand at a higher level, what are some of the transformations in these different components?
Yeah, so high level process. So like I said, it's going to be batch fed fermentation. So what's that mean? Well, first I want to be clear. I have worked in life sciences and they are very, very particular about protecting their intellectual property. So the process data you're going to see, I want to be clear, is simulated. It is fake, but it's very realistic. So I'd say the behaviors are going to reflect real processes, but obviously the numbers and things are going to be different. This facility has, I would say, 4 main pieces of equipment. It starts with a single-use mixer, and for our facility, we have data where it's going to make the base media feed for the bioreactor. So there's going to be phases in there to do the setup, the media dishing, mixing, transfer out. Then there is going to be that single-use bioreactor. That's the main event. We're going to have, again, the recipes and the phases. This is all batch for growth. And that is going to take about, I think, 6 days worth in that bioreactor. Afterward, we picked only 2 pieces of equipment to simulate the downstream purification. Honestly, it's a simulation. We couldn't simulate everything, so we just picked 2. And we said it's going to go to a chromatography skid And then from there, it's going to go to a TFF skid. At this facility, we're assuming that at the end, you just kind of get your product, and vial filling wasn't in scope of the simulation. And again, that's just a constraint of how much data can we put together for the conference. So what I think is going to be really exciting and different for this year is that batch element. We do have recipes, we have formulas, we have phases, we have these clear events of going from one piece of equipment into the other. So there's lots of opportunities for vendors to try and do that genealogy tracing, because at the end of the day, every pharma client has to create that batch record where we say this is everything that went into it. And that's all basically data. And the truth is, a lot of sites today, it's paper based, which is not ideal.
Mm-hmm. And a quick follow-up again, just to try to understand the process a little bit better. So the mixer, I'm assuming, should be fairly straightforward, but the bioreactor, what kind of data does it normally generate, or what's the instrumentation on one of those?
Yeah, so do I want to share my screen? I don't know if I want to do this. I actually have...
in a general sense, right? It doesn't have to be this specific bioreactor,
okay,
but just so the audience that doesn't have context maybe understands what a bioreactor should give us.
Yeah, okay. So a bioreactor in this case, what we have going is we have some temperature control, we have some DO control, we have some pH control. And the way the pH is being controlled is we have a pump that's going to pump in, I think, some base as needed. So there is a trend going pH, and you see it go up and down, and then when it's a certain level, the pump comes on, that comes down. We also have an agitator. We're going to have a waste scale indicator, so you can kind of see as we add in more media. Because the thing is, as I said, it is fed batch over 6 days. So what that means is the bioreactor first is just sitting there. You fill it up with media, which is basically just the food. Then you warm up the food. And then you do the inoculation, which is where you actually add in your active, like, you know, enzyme, fake enzyme in this case. And then it's going to grow for a few days. And as it grows, we then add different feed additions. So they're going to see there's multiple pumps that add different ingredients in. I forgot off the top of my head what they are, but it is in the batch record what specifically is getting pumped into this thing. So you are going to see the weight go up in time. And then at the end of the 6 days, it will transfer out and be put into like a little portable tote as it then gets carried down to the downstream. Another thing to note, though, on the bioreactor is this is really common. Normally, the operators do take samples, and they're called like cell count samples. So basically, they take a manual sample, they bring that over to a piece of, it kind of looks like lab equipment, a cell counter, and that tells them this is the viability of the cells that you're growing. So we actually did generate those cell count files as well during the run. So we'll see what people do with that. Hopefully they'll find a way to connect all that data together, but that is going to be another like paper file that they're currently, our operators at this facility do that cell counter, and then they write the value into their paper batch record.
Interesting. And let me, I guess, ask you on that side, and obviously we don't want to reveal or give any hints to potential vendors that might be watching, but again, in the real world, well, no, I mean, we want to have an even playing field, right? I think we want to see what they build and come up with not next week, but the week after. But in a general sense, a bioreactor, barring operator error, right, barring some of the quality checks that one might do, what are some of the failure points that might occur that would then lead to a batch being, let's say, rejected from the next step?
Yeah, so that's a tricky thing about a bioreactor is it's an all or nothing. It's either great or it all went bad. Some common challenges in general with bioreactors, I'd say the most prevalent one is if you have contamination of some kind. And that's just the nature. I mean, that's the tricky thing, because with single-use equipment, people have to set them up, they have to connect. If there's a leak or if there's a tear, if something wasn't clean, contamination could enter. And the worst part is it might not show up for a couple of days, right? So that's a tricky part. It really has to make it till the end of day 6. Other problems is, of course, any equipment failure. So our bioreactor, it has a bunch of probes on it. It also has a temperature control unit. So sometimes those things go out, and then what do you do? So lots of different opportunities for things to go wrong, and we'll see what happens.
Interesting.
I I love that. I guess let me ask you one last question about those potential failures. Not necessarily within this, but for some of our listening and viewing audience who may not spend as much time in life sciences as you do, Amy. How often do you see those failures? Are they like frequent, like we might see several a year, or are they so catastrophic for many facilities that one or two a year may be enough to have wholesale changes within an organization or a facility?
That's a good question. I think it depends on what space you're in. I would say if you're in the R&D space where they're trying to figure out how to scale up the process for the first time, they're much more common. When you're in the larger scale manufacturing, they really aren't that common, thankfully, but they do happen. Like I have seen them happen, and you do have these. They're a big deal. It's a really big deal. First, because like it's a safety problem to have poor quality, and then the other thing is it's extremely expensive. So the frequency, ideally, if things are going well, it doesn't happen. Maybe like I don't know, once a year, twice, but it's a significant deal when it does. There is always, it's like a huge deviation. You always have a root cause analysis, and a lot of time and money goes in to make sure it doesn't happen again. Because I can't stress, like these batches, they're millions of dollars. You don't want to lose.
Absolutely. I've done work on the beer side, and those batches are only high tens or maybe $100,000, depending upon how large those tanks are. And those are very uncomfortable meetings and root cause analysis that one has to go through when there are issues, especially if we didn't clean it properly on that side. So I can imagine how uncomfortable everyone is, rightfully so, during those RCAs when we have lost millions of dollars. Yes, absolutely. Absolutely. So anything else from your perspective, Amy, that you think is worth talking about specifically within the batch processing facility itself, and those pieces of equipment?
Well, so I think what would be cool to talk about is some of the other information that's going to be there besides just the like equipment. So something new that we decided to do this year was last year, ProveIt, the UNS kind of was already modeled for that facility. This year, we made the decision that, okay, for Enterprise C, in our UNS, we are only providing the edge namespace, which means the data in the broker is intentionally not contextualized. You're getting stuff like FIC 2005. What is that? I don't know, right? And the reason we did that is we wanted this facility to reflect where most life science customers are. A lot of them are still trying to figure out that first step of how do we even get our OT data modeled in a way that is intuitive. And so to that point, we also intentionally added a bunch of paper files to keep it very realistic. So a lot of the context is not readily right now in OPC tags or MQTT tags. It's in paper files that we shared with the vendors, and they have to dig through it in order to figure out what's the stuff actually mean.
Go ahead.
I was going to say, I love that. And then again, just for context for our listeners who may not be in life sciences. No. Like I specifically want to talk about the paper files. So you had mentioned those are very common. And we have had several conversations with the commonality of paper files versus the push several years ago to go glass on paper or digital files. But the vast majority or a large portion of life sciences organizations are still running on paper.
Yeah.
Okay. Absolutely. That was the point I wanted to make. Go ahead, Vlad.
I was going to ask, like, again, I think for context, for those who may not have had to add such context to the data, what is the typical step, right? And I'm assuming this is not some proprietary information, and at this point, probably all the vendors that needed to figure it out have figured it out, but what is a life sciences facility to do with, supposedly raw data that they are collecting? Like, why is that important? And ultimately, how would you get that kind of information?
Yeah, so it's really important because it is just a requirement from the FDA that the life science manufacturer has to give them this batch record at the end that tells the story that says, listen, we manufactured this thing. There were no alarms. Everything was in spec. And, you know, you have to somehow explain that, like, this signal here corresponds to a quality attribute like temperature. And we link that to our science that proves it's in range, right? So you always have to do that context mapping one way or another to just be able to do an actual submission to the FDA, right? The way that it usually works, though, is getting that context involves, like I said, you usually have to go to the batch record, or you have to go look at documentation to figure out what's the functional spec, like what's supposed to happen, how's that actually correspond to the data I'm seeing. And so it usually involves talking to a lot of different people and then figuring out a way to kind of standardize on what that modeling is. But I will tell you something, though. I think a lot of life science companies, and this is probably true for most in industry, it's kind of tricky to standardize on this stuff. Like UNS is newer, but like a lot of people have had Pi and like their asset frameworks for a very long time. And yet still at every site, it always seems like somebody came up with a different model for what a bioreactor is. And it's, even though it's more or less the same equipment we've been dealing with for decades, right? And I feel like part of the story that maybe we need to spend more time on is honestly the people aspect and the cultural aspect. Because from a technology standpoint, we can all find a way to map something into a friendly name. Like, that's not very hard to do. The hard thing to do is to figure out, how do you coordinate enterprises to agree on what that is, and how do you get people to actually use the data governance rules that you have and actually like kind of create that mindset shift culture where you care greatly about data governance and adherence to it.
Interesting. I guess like when I worked on batches in food and bev, predominantly regulated by the FDA, I've seen some mostly fairly basic logging mechanisms for those batches that would basically track the temperature for a specific batch and then be again left in a drawer until somebody makes the request of getting them. But from what I understand in life sciences, it's a little bit more complex. You need a record that's a little bit more intricate, perhaps, with a lot more information in it than just the, let's say, the temperature of the bio.
Yeah, I mean, the records that they'll so they can be like hundreds of pages long. Like there's, I don't know, maybe it's the information age. There's a lot that you have to prove that this went right and according to plan. And it's always a headache trying to figure out, okay, how do we actually reach into all of this data that we have to compile that and then give to the FDA? And it is, and I have been at sites where it is like these paper records that get locked in a cabinet and you just have to, when the auditors come, all right, go grab all these binders and you're flipping through, and we can do better than that, right?
Interesting. Let me ask you a question based on an earlier comment, right? So it is, I guess, a general expectation. We don't know yet if the vendors will actually meet it, but to integrate into these SASME profiles. And I've talked to the group a couple of times. I've not have experienced it hands-on myself. I've seen a few demos. Could you paint us a picture, I guess, like what does that actually solve in maybe in this case, but in a general sense? And you said that you can create a profile that then somebody else could use. Could you maybe elaborate on that a little bit more, if you don't mind?
Yeah, absolutely. And I don't have it on me. Maybe I can share it later. What's cool is Jonathan Wise actually made a GitHub repo that's public that also explains the SASME profiles and what we're doing for ProveIt. So the long and short of it is the ProveIt requirement is basically, we don't want to reinvent the wheel. We want to bring standardization to industry, not just a site, but can we all agree? Can we actually get some real interoperability here on what these data models are? So SASME is, you can go their SM profile, you can make an account, it's free. And basically you can browse through it and there are these data models there. Now, they mostly look like OPC-UA information models. Now, personally, when I look at them, I'm like, okay, these are a little bit equipment heavy. I don't think these map on particularly well for what I would want to use in like maybe Ignition, for example. So what's cool for ProveIt this year, they're saying is that's fine. If you think you have a better data model that you want to use for your solution, the only requirement is that you then share it. So if anybody wants to be like, hey, you know, I really liked that UDT Amy made for a bioreactor, I want to use that at my site. I know how to get that model. And so I believe there's 3 ways you can kind of go about it. You can make a profile and put it on the SESME SM profile. I think the rules are very lax. They even say you could put it even just on like a public Git repo and then have some kind of link to it. And this is going back to the idea of like standardization and the idea that you should be able to figure out the schema of your payload without having to sit and wait for it. Because that's one of the things with MQTT. If you have a broker and you don't have your retain flag on, you might not know if there's a topic and a value that's there until it gets published. And like, that's not ideal to build solutions on. You kind of need to know, I want to know what is all the possible data that I'm going to get and what's its structure. So the idea is you can go and look at the profile before even any data comes, like your schema is decoupled from the actual value. And you can be like, oh, okay, I know that if Amy's publishing stuff, it's going to look like this. Great, I can actually build solutions now that are ready. So that way when data comes, it already is good to go.
It is an interesting challenge, right? And I've certainly been long enough in the industry to feel that it could go in different directions depending on how people use the profiles and modify the profiles. And I'm sure there's going to be an appearance of, Amy's pump v12 with Vlad
Yeah.
13, right? And then it just kind of spirals out of control. But I think a lot of us in the field are reinventing these. And I think every integrator, to an extent, they're not necessarily secret sauce, right? But they have built out a set of profiles or templates, however you want to call them, that they will go and reutilize in the project. I think, again, but the danger then becomes, for me, at least in my mind, now you have, a standard POM that works at one side and then it gets augmented, and then it's just like such a big universal type of a structure that it becomes challenging, I guess, to use for other applications. So I definitely understand the problem. I'm curious to see how it is applied. I have not, I guess, seen it from the groups that will be showing it at ProveIt. So I'm curious to see what they come up with. I'm assuming that at this stage it's probably published publicly, either on the SESME website or on the GitHub that you've mentioned. Yeah, I'm curious to see what they will be doing. Dave, what are your thoughts?
I'm thinking that if I take Amy's bioreactor profile and Vlad's pump profiles, I may not have to build anything and go ahead and have my own enterprise C fairly soon. I think I'm understanding what you guys are saying. Maybe fastest build ever on my side, because I'm just going to completely copy paste all of your profiles and work in there. So I guess I also on the profile side, I'm interested to see where they go, right? Like, I think that we can all, to both of your points, agree that there is value in the standardization. I think Vlad and I have probably talked or made jokes on this show dozens or hundreds of times, and I'm sure we've all talked to end users as to, hey, this project may take 2 hours if everything is perfect, and it may take 20 hours if Dave programmed this PLC and Vlad programmed this PLC and Amy programmed this PLC, and they all have completely different name change structures, and Vlad decided to go build his own language because he had an extra 45 minutes, and now no one knows what any of these are, right? So I think it is really interesting to see where they go. My understanding is that the profiles were of an addition. It's certainly an addition from last year to ProveIt, and it will be interesting, right? Like, I think that we've got the opportunity to absolutely go hit it out of the park. I think we've also got the opportunity for a lot of groups to go completely rewrite a bunch of stuff on Monday afternoon and Monday evening because they have completely missed the SESME profile portion of the ProveIt sessions, and I think that is some of the fun. We'll go get back into Enterprise C in just a moment, but I was going to say, I feel like last year, just from Sunday night of vendors only into Monday of first ProveIt sessions, there were a lot of rewrites. And then from Monday, when we finished at 9-ish in the evening last year, to Tuesday morning, I would imagine the vast majority of people rewrote at least a part of their presentation, if not whole rewrites of their presentation. And I feel like you can see how the presentations and the quality and kind of like the baseline standard it rose over the course of the first week, at least from the observer. Amy, you can either choose to comment or not comment from the MC side. From the observer side, I feel like they generally got better as the week went on. And then going into ICC, in which we had a number of ProveIt sessions, I feel like we carried that baseline of we're going to have really good presentations and we're going to have really good demos, and it's going to be much more clear and concise how we go about doing this, as opposed to we've got 45 minutes. These are my 5 slides. I'm going to go up on stage and maybe I'll go pull up an ignition and maybe we'll go pull some MQTT tags in and go publish them somewhere. And then this is my presentation. I hope you guys pay me money, as we could have seen. And I'm really happy that it has continued to raise the bar session over session. And I am very excited for year over year as well.
I agree, especially because now people are starting to get the hang of what like a ProveIt session is. Mm-hmm. And I don't know, maybe your audience doesn't know, but do you mind if I just reiterate kind of how it works? Yeah, so what's really cool about ProveIt is basically you have to do some kind of demo, and there are just a few questions that you must answer, which is what problem did you solve? How'd you do it? How long did it take? What's it cost? And then there's Q&A at the end. And like I said, this year we're hoping people are using the SESME profile. Mm-hmm. And I personally love the how much did it cost question, because I personally have been to a lot of conferences where it's like, oh, that's so cool. Like, but like, how does one actually do what I just saw? And it's like, oh, let's schedule a demo or talk to sales. And it's like, there's a big difference if what you're showing me took a year versus a week. And it's like, Absolutely. So I enjoy the format a lot of ProveIt.
And it's generally a very uncomfortable question to ask engineers on the presentation side, right? Like, I don't know very many engineers or technical people who are happy or willing or bring up the topic of money, right? Like most of the time we're like, let's not even go have that conversation. Let's pretend you can have it and give me 3 McDonald's cheeseburgers and we're absolutely okay. It's almost never going to cost 3 McDonald's cheeseburgers, even though the inflation of those things is getting a little crazy. Having said that, I'm really happy that was done. And I have reiterated that similar point of we need to be able to present a number. Last year, there were several groups who were struggling to come up with a number and really hoping they didn't have to talk about the number until they were forced to go talk about the number. And again, I think it's really important. I am suggesting to all groups to go like have that on a slide so that we can go talk about those 4 questions and be as specific as possible as one can when it comes to what problem did we choose to solve, so that we can correlate that directly to the amount of time and money that it costs to go ahead and do that. Because there are certainly people in the audience who will know if those numbers are unrealistically low, right? Like I feel like it could be easy to say, hey, this is $100,000, but I bet I'd get a lot more conversations if I told people it was $15,000 worth of work, up until one gets to the conversation of, okay, I'd actually like one for $15,000, and then that becomes an issue. So I 100% agree, Amy. That was one of my favorite parts about getting to watch you and Jeff roast a bunch of people up on stage last year who were perhaps struggling to quantify a dollar amount. I can only imagine that it was nearly as awkward for you guys as it was for some of us in the audience watching.
Absolutely. You get your chance this year, right?
I will, yes. I mean, I don't have that problem of being unwilling or unable to talk about money. So I will happily go roast a group if they're unable to go put a dollar figure up on stage. That will not be it. Of my many misgivings, Amy, that is not one. As Vlad will tell you, being able to talk about that is not one. I want to talk a little bit more about some of these paper files and things, but before we get back to that, Vlad, I wanted to let you jump in, see if you had any other comments or had any other thoughts on the SESME profiles.
Well, I guess the brief comment is I think that the conversation about the financials also reveals what the relationship with that group is going to be. And for me, it's very telling, again, having spent many years on the plant floor, and especially for the end users coming in, they know when a group is, and again, everyone wants to be ambitious, right? But is pitching them the idea that we can do this with 10 minutes worth of downtime. It's just plug and play, and it's going to absorb all of that data. I think that being extremely transparent is what ProveIt is all about, and you need to be very cognizant of, a explicit cost for the license versus the cost that it took to build out a solution. And I think that, again, if you see a vendor that is not being necessarily transparent, or at least telling you what are the constraints of getting there, is quite telling, at least for me. So that's the comment I will make on that side. In terms of profile, like I said, I'm very curious to see where it goes. I have not had any feedback yet from the groups that will be presenting that have built them out. I know that Dylan has shared, I believe that he has already incorporated them into his demo. So there's going to be obviously vendors that would have completed that challenge, but we'll see how it evolves. I do want to also talk about the files in addition to the actual data. And if I may, Dave, let me start that question. So, Amy, you've mentioned the batch records, and I think that is generally understood. We have two other notes. RCAs are also, I would say, depending maybe on the profile of the listener, may not understand what that is, but also the cell counter files. Could you expand on those two, cell counter files and RCAs? What is expected for this facility?
Yeah, so the cell counter files, basically, they are little text files that machine would output. So we kind of created a fake cell counter machine. So it's a fake format that it output, but it is kind of realistic of what we have actually seen because we didn't want to infringe on intellectual property. But basically, in that bioreactor, there is data there that the operators took a sample, they walked up to it, they put it in, and they spit out a number saying, this is the cells, this is their viability. That text file with its certain format, those are the cell counter files that exist. So there is this digital record, but at the moment in the facility, the operators are manually writing that number into their batch record. So that's a use case that we'll see if anybody tries to tackle. And then the other ones is, in life sciences, when you get deliverments for raw materials, they always come with these certificates. And basically the certificate says, hey, this thing expires on this date, or here's the test results showing that it is indeed good, especially because we use a lot of single-use equipment. So you use it once and then get rid of it. So it usually comes with some kind of file saying, hey, this whole lot was tested. You can trust this stuff. So because it's life sciences, they usually have to go and actually check, okay, is my thing good? Has it expired? Yes or no? Let me write that down. Okay, it is. Now I'm going to actually open it up, install it, and use it in my batch. So that's another layer of just good old documentation detail that we threw into for our facility.
Let me ask you a follow-up on the cell counter files. So once you do that test, right, that the operator completes the test, you've mentioned earlier that obviously there could be deviations because of sanitary issues. I'm assuming that the CIP was not correct, or they didn't clean the bioreactor correctly. But what can the operator do otherwise, right? They see a high cell count, or I guess a low one. What is possible in the real scenario to correct in the process, besides just saying, well, we're going to reject the whole batch and start over?
That's a good question, and I wish if I had an answer, I could probably make a lot of money. I don't know. Personally, I'm not a PhD scientist. In my experience, when things go wrong, by the time I hear about it, it's a lost batch.
Gotcha. Okay.
Sometimes I guess all you can do is just maybe there are some parameter tweaks you could make if you're a scientist, okay, maybe we have to change DO or change the amount of pH or something. That's above my pay grade.
Gotcha.
A lot of life sciences is trying to be as preventative as possible. That's why there's so much tracking on what happened, if it went wrong, what can we do to make sure it never goes wrong again, kind of a thing.
Gotcha. And I'm not trying to stump you with those questions. I'm just very curious about the process. I think it's super interesting. And even, if I were to collect that data, let's say as not a vendor that's presenting, I personally would have to do a lot of research to try and understand, well, how do we fit this into our strategy? What does this actually tell us? What does the actual facility would expect, on that side? That's why I'm, like I said, just purely curious to try and understand how this all fits together.
Absolutely. I would say to kind of to that point, Amy, that's why I'm really interested to see the groups that come up with some of the golden batch that you had talked about. I would imagine we'll see several groups who are coming out maybe some MLs, maybe some AI solutions that have the golden batch, and it'll be interesting to see what that looks like when you have the data that's provided across the batches plus some of that paper data and what they're able to come up with. Perhaps that would kind of move us in the direction of, given X state, we have to do Y to stay within the realm of a positive batch moving forward.
Definitely.
Let me ask you maybe a follow-up to Dave's point. So I think the big question for anyone attending ProveIt that is perhaps not in the shoes of a life science facility operator is, what can that industry expect to see? And I think we touched on that just a little bit in the earlier conversation, right? That it could be obviously showing some quality type of defects or deviations. It could be optimizing the process, right? Or looking, just like recording what's going on so that you could have that for compliance purposes. But again, if you do have full context of a life science facility, what could you expect being shown for this facility that solves a tangible problem for you?
So I think that one other thing that they could be doing would be maybe like work instructions. If somebody was very knowledgeable about this equipment, they could say, hey, listen, this is how, I am frozen. Oh no. Let me.
Okay. I'm sorry. I apologize about that, Amy. You were looking, and then I heard you talking, and I'm like, the picture isn't moving, and I'm not sure if it's just my side of the internet.
Sorry about that. I have no idea what's happening on their front. But I guess I will keep talking while I try to figure out the video thing. So I think the other thing that's going to be really interesting in itself is just seeing what problem do they decide to fix. Because this facility, like I said, it's paper, so many starting points. And I would argue one of the most valuable things is figuring out what is the most important place to start. Like, because building a UNS, like getting data extracted does cost time and money, right? So what is the use case that actually justifies investing in all of this, hopefully new infrastructure, a new way of building? Yeah.
Absolutely. Amy, while you're trying to fix that, we'll let you go ahead and try to fix the video. I want to go ask Vlad a question in relation to ProveIt. And so you have anywhere between 20 and 45 minutes. Amy, no pressure. No pressure on that. But no, Vlad, I guess, what are you most excited for when it comes to the addition of life sciences to the ProveIt conference?
Well, as I've mentioned a little bit earlier, I have some experience in FDA regulated environments, not specifically in life science environments. So I am definitely very curious to learn what are some of the constraints and how they are tackled by the different vendors. I think, or I guess, like, I'm expecting to see different groups that have perhaps worked in these environments to have a fairly significant edge, because without, again, knowing all of these constraints, I think it would be fairly difficult for vendors that, let's say, provide hardware or pure software solutions without the specific context to build out something tangible. In terms of, I guess, what I'm excited about is like batch, right? So batch processes are inherently very complex, carry a lot of information, and I'm curious to see not only the business solution, right? Obviously, that needs to be there to be quote unquote proven as the value add. But I'm curious to see how the technical side is handled, because again, I think there's a lot of nuances and details on how you ingest this information, how you store that inside of your either historian or just a normal database. How do you present, and which information you choose to present or discard. So for me, a lot of those nuances play a very important role. So I am very curious to see how the different vendors are going to handle them. And to Amy's earlier point, again, I think understanding the magnitude problem, which, like I said, I don't expect many vendors to understand, but those that do understand, we have a list maybe of 5 problems we can tackle. What is the magnitude of that problem? What does it actually cost the business, and then propose a solution that matches the ROI. Because again, in my experience, if you can pitch or create a proposal that has an ROI of 9 to maybe 18 months, depending on the size of the facility, that's the only time it will actually be accepted. So, like I said, I'm very curious to see some of the financials of the solutions at ProveIt.
Absolutely. And to that point, it would be interesting. I don't know how feasible it would be to go talk about what that ROI would look like for these projects. And I don't know if that's something that we'll see vendors go talk about that. Maybe vendors who have do a lot of work within life sciences, or maybe that's an ROI calculation that some of the attendees are going to be doing when it comes to sitting down thinking about that solution and being able to move forward. But no, Amy, welcome back. Thank you so much for that. You are back. Wanted to go back and talk about like life sciences and what the companies should expect. What do you think life sciences companies should expect from the ProveIt sessions? Do you think that there'll be a lot of aha moments? You probably know, you being with an integration on the life sciences side, probably have a better idea of which companies kind of focus on life sciences versus which companies may dip their toe into life sciences but may not know the processes. Do you think that the expectation level should be very high for some of these life sciences companies going in, or do you think we're going to be a little all over the board?
I think the expectations should be high. So what I'm really excited about is that I think that they're going to see a lot of different solutions that aren't the normal players. So like what I mean by that is I won't list any names, but like when I think life sciences, there's kind of the same list of like, it's almost identical, a lot of these facilities for what they're using in their automation stack. And what really excites me about ProveIt is we have so many new players coming in who are disruptors. They can do, I would argue, what the classic ones can, and then more. And that's the whole point of ProveIt, is we're actually able to prove and give these new players a chance to actually demonstrate, hey, listen, you can do MES a different way. You can do your CMS a different way. You can do documentation a different way. That's much more open and hopefully also much more affordable too.
Let me ask you perhaps a dangerous question, but very topical for the data and the facility. Are you expecting some interesting AI solutions? And if so, because for me, it feels so difficult to structure in a coherent way a picture from the plant floor data into something tangible like a dashboard. But is there anything maybe that you're expecting or hoping to see at ProveIt when it comes to the use case of AI and LLMs for this specific facility?
Yeah, and this kind of goes into, I mentioned this in another video, so I don't mind saying it again. Something fun that we did for our simulation is there's a reason we did 4 batches and 4 weeks of data. These batches are not pristine, perfect batches. Things actually do go wrong in the facility. So what I'm really hoping for is to see some use cases where AI can kind of pick up on that. Maybe before something hits the hold stage, it's like, oh, that seems a little weird. Or it's able to compare and say, wow, compared to this other batch, things are a little different. I think that for life sciences, everybody wants help with those root cause analyses. Everybody wants help figuring out, what am I supposed to do when things aren't going according to plan?
Hmm. Yeah, it's super interesting, right? And I guess, like, again, just thinking about different solutions, I think different vendors will have probably different takes on, I guess, where they stand and where their capabilities on AI stand. So I am excited to see how they will utilize AI, and it could be anything from, again, maybe they structure the Sesame profiles utilizing AI. Here's like a bunch of data. Help me structure this in a cohesive way. Here are the profiles versus, again, maybe extracting some of that knowledge or operational gap. I think it's going to be very interesting to see. There's a question. So let me bring this up from Peter Sherwin, who's asking, And I guess like the general rule of this year, right, is you have 3 different facilities and you can pick and choose. I know that some vendors are going to do all 3, some vendors are going to be doing less than that. So he's asking, do we have a pulse, or I guess a general count as to how many companies are providing life science solutions at ProveIt? Like, do you know how many are attempting the third factory?
I don't off the top of my head, but I do know that I do know of some, but
Okay.
I can tell you this: if you go onto the ProveIt, they also have a page for like the workshops. You can also see there that there are some companies who are very much targeting life sciences. And I want to say that, did they take that suggestion this year? That part of the schedule, you should hopefully be able to tell what enterprise they'll be working on. But I do know there are some. Unfortunately, I can't tell you off the top of my head. I don't remember, but we can try to find out.
I don't know if that exists. If it doesn't, that would be an amazing thought to know which enterprise or enterprises. To Peter's question, I guess I almost went into October thinking to myself, wow, it'll be really hard to figure out which one enterprise I would like to go build this on. And fairly quickly, I had a number of conversations in which groups are going after 2 or all 3 of the enterprises. So I would be surprised if we don't see at least 50% of groups having some sort of enterprise C solution. I wouldn't be surprised if the majority of stage presentations and large stage presentations at least got into the life sciences and enterprise C, which is really exciting. Some of them I think will probably connect it together. Some of them may have 2 separate demos. I feel like it adds a huge level of complexity. Like, it's really difficult to do one ProveIt session in 30 minutes, but now we're trying to do 2 ProveIt sessions and you take out like 5 minutes on each side. So now we're trying to do 2 ProveIt demos, each 10 minutes apiece, when lots of groups are struggling to get it done in 25 minutes for a single one last year. So I think that level of complexity will be interesting.
One thing I do want to suggest, though, there is going to be, just in general, it's really exciting. There are a lot of life science attendees coming. So
yes,
what I would tell them is, one of my favorite things about ProveIt is the Q&A at the end is, it's facilitated by the MCs. So they're going to pick the questions that they think helps the audience the most. So if you're in life sciences and you went to a ProveIt session that wasn't for life sciences, but you have a question about security, or you have a question about does it have audit control capabilities? You should ask it, because most likely it will get picked. And the cool thing about ProveIt is technical people. They will have the answers. If there is a conference to get technical answers, this is it.
Absolutely. I would agree. I would agree. And to Amy's point, again, any attendees, and I know we've got a bunch of attendees in the chat, come ready with questions. Amy and Jeff brought up together this really cool application that you can go scan in and go ask your questions. Like, go ask questions during the session, go ask particular and specific questions. We got through a lot of them for each of the sessions that I attended last year, and those go pretty quick, right? So reasonably be able to ask 5 or 10 or more questions over the course of a 10 or 15 minute Q&A session is very reasonable. So come ask questions, come ask difficult platform questions. Those I feel like are the best questions to be able to go ahead and articulate that in. And I know that there will be questions, or at least on my side, there will be questions to all of my presenting groups as to if they do work within life sciences, or how would this translate to life sciences. I don't know the answer to all of them yet, because I don't know all the enterprises they're working on, but that will be good. But I guess we do have a couple more questions, a couple more topics. We do have a ton of people in the comments, not a ton of questions, lots of people saying hi. We got Peter in the comments and Mark O'Donovan in the comments. Mark, are you going to be at ProveIt this year? I know we saw you last year. I don't know. No, Vlad is saying no. Vlad is the master of all ProveIt attendee lists. Yes. Vlad knows everyone. So all of our vendors out there who really want all of the lists, go talk to Vlad. But no, appreciate it to you guys. We've got Arun in there. We've got Thomas, who had a bunch of awesome comments about Wow. UNS and a variety of other things. Amy, I want to ask what you're most excited about in ProveIt, but before we go ask kind of those last questions, again, if you guys are listening live, you guys have specific questions that you want to ask Amy about Enterprise C, or Vlad and I, or Amy about kind of our thoughts as we get ready to head into ProveIt, please feel free to go ahead and do so. Amy, I want you to put yourself in the shoes of an end user, right? So like if you're an end user and you're there for life sciences, as we were just talking about, what would you like to be shown on Enterprise C? What would wow you? Last year, there were a couple of aha moments. Or wow, that actually solves a problem that we've had. So if you were an end user, what are the things that you think would be most impressive from the presentations?
I kind of mentioned it earlier, but I'm going to go back to it. I feel like the thing that would be the most interesting is the person who can kind of tell the story of that historical data really well. Mm-hmm. And that's just because historical data is a harder problem. And I know UNS is real-time state of the business. It's not something that I don't think MQTT is meant to solve, but there is this huge demand of how do I get my story of what happened from all of these different pieces of equipment compiled in a way that's like easy to understand and then share with the FDA. That is always just a pain point. It's something that everybody, I feel like, spends a lot of time solving over and over again. And I feel like that could be a use case where AI could be really cool if it's like, hey, listen, in the past, this happened. Maybe we can compare. Again, it all comes back to those like golden batch analysis. Those two things I think are the most interesting for life sciences. I hope somebody does something with that.
I hope they do something with that as well. You've got us really excited as to what could be. So I am personally hoping. I am like, please someone spend the time and read through all of the paperwork that Amy has gone to put together. We've got an awesome question from James that I think is really good, saying, Amy, what are the biggest challenges for the have-nots in life sciences? So not the Pfizers and the Lillys, for all of the probably small to medium-sized, although I feel like small to medium-sized in life sciences, like a small to medium-sized refinery, and we do $2 billion and we're still small. So on the have-not side, what do you think the biggest challenges are?
So I feel like, so when we're going smaller, they're usually CDMOs. And so that's a contract manufacturer who's trying to make something different. And they have it's very challenging, right? Because like the big names, they usually have some like name brand drug, like a weight loss drug, where it's from a process standpoint, at least you're doing the same thing out the door. Like once you get it, you're good to go. It's really competitive if you're in that smaller batch space. And so I guess the challenge for them is, okay, how can we be flexible with all of this documentation? Like, how can we quickly adapt to a new process and still validate it and get something out the door? And I have my personal opinions about that. I feel like that is the greatest call for why you need a UNS, why you need to be digital. Because the more that you can automate something, the more that it can be inherently electronic and inherently have that audit trail. That's one less thing that you have to validate. Those paper records are much worse, I would say. So, yeah, I don't know. Do you think that answered the question, or should I?
I think that's good. I think that's good. I spent a lot of time on paper chart recorders when I was in process controls. Maybe some of the people listening would understand, but I feel like every week we were shipping out half a dozen paper chart recorders, like brand new paper chart recorders, and then the different colored pens of the chart recorders, and then the different paper and the different paper on different scales, and then there were the thermal chart recorders. And I once attempted to go upsell to have some like digital outputs. And I don't think I've ever been looked at like I was the dumbest person in the entire world than when I suggested that they buy this chart recorder that we can also pull the temperature data out from, as opposed to just taking this chart recorder, taking it off the chart, putting it in the box, and taking the box and putting it in the storage room on the shelf for if and when, in this case, mostly FDA groups were coming for that. So I completely understand. Mark's got a great comment or in question. Maybe we can go round robin style. Are there any particular vendors, especially ones not presenting last year, that you're excited to see, or generally what you are excited, what you are excited to see? Vlad, let's go start with you. Keep you on your toes.
Sure. So looking at the list of sponsors,
Mm-hmm.
there's I would say, I guess, like, there's the usual suspects. So Inductive released 8.3, so I'm curious to see if they're going to demo some of the new features,
Mm-hmm.
especially like messaging queues that I think are very relevant
Mm-hmm.
in the batching processes.
Maybe
Curious to
MCP on the inductive side, yeah.
Exactly. Curious to see what Dylan's group Abelara is going to put together. I want to see what reply concept, and I guess I'm listing these quick, right? Because otherwise, like, we can discuss what they're all going to tackle.
Going one by one
probably
down
next
the
week.
down the rest of the schedule for the next 3 hours. Everyone buckle
That's right.
in.
There's again, there's some groups that bring hardware solutions that I think are going to, and again, to the earlier comment, right? I think that I also need to set my expectations differently depending on the group,
Mm-hmm.
because a lot of the vendors are going to be experts at their technology, not necessarily the partner that you would work with to
Yes.
implement such solution. So I'm cognizant of that as well, right? There's going to be different sponsors and different groups. So like I said, I'm curious to see the vendors on the hardware side, a couple of different software solutions, but more importantly, how some of the integrator groups handle, again, like to Amy's point, like actually adding value to the customer, because I think they have that boots on the floor context that some of the vendors may not have. So I will be definitely attending those sessions with Enterprise C in mind.
Absolutely. Amy, would you like to go next, or would you like me to go next?
I can go. So this is like such a nerdy answer. I'm actually really excited for Blue Mountain.
Okay.
And that's because they do a lot with, I would say, like documentation and CMMS. Like, they're already a name in the life science space. So I really want to see how do they kind of, but I would say traditionally, like 5 years ago, I would have never thought that they were compatible with like a UNS or anything like that. So I'm happy to see them here, and I'm really curious to see what they're announcing, what new feature it is that brings them to ProveIt. Yeah.
Absolutely.
Could you give us some
I'm
context? I'm not familiar with Blue Mountain, if you don't mind.
Let's see if I can read you their description. So let's see. Yeah, they do asset management solutions, and they're specifically in life sciences. So yeah, there's like CMMS, and then they have Blue Mountain RAM for equipment maintenance and all, work orders, all that stuff.
Yeah, I was going to say on my side, I don't think you can go wrong for all of like the title and gold sponsors, right? I think all of them were there last year. I think all of them put together really good presentations. I would say one of the surprises for me last year was MaintainX, in large part because I'm like, how is a CMMS going to show up to this UNS conference? And so I think that was a particularly interesting to see how they fit in to the rest of the ecosystem, very similar to Blue Mountain. And Amy's comments of this year. So I think it's really hard to go wrong with basically any of the sessions that you're going to go in. I am particularly interested to see some of the life science groups who are coming this year because of the life sciences. I think that is particularly interesting. And then I feel like I can't go on the internet and refresh a LinkedIn feed without going and seeing a new speaker or someone else. We've got a bunch of oil and gas speakers that are being added almost daily or multiple times a day at this point on Thursday afternoon. It feels very appropriate being in Texas, and I've got a couple of groups that I know who are going to be there who have experience in oil and gas, and so it's good to see kind of the continued expansion of the ecosystem. So I'm going to take the cop out and say it's hard to go wrong, right? Like I feel like we couldn't go wrong last year. I feel like we can't go wrong this year. I am personally impressed with all of the groups who I know are leaning hard into the life sciences because it's an interesting opportunity, and there are a lot of life sciences executives who are going to be at the show. Specifically the Siemens folks. They have brought in Siemens Healthineers, which is a different portion of Siemens that I know exists because I had a conversation with them at some point last year. But they're focused very much on the life sciences team, but with the same team that went and built the enterprise solution last year on the SCADA and orchestration side. So, man, Mark, you asked a really good question, and you got at least a super cop-out answer from me. I think they're all going to be good. I think that they are all going to be good. I think the bar is going to continue to rise. One other group that I'm interested to see is Thread. So Bob from Thread was at ICC. He had a really awesome presentation as to how to suck in and build kind of a digital map, knowledge map. Boom. Thank you. Yes. Knowledge graph from the UNS data, and he did it live. And that is absolutely crazy because one, super high pressure situation, and two, doing things live, the demos always break. So I thought that was fantastic. I have heard tell of very, very positive things of the work that they've done in the short last 4 months. And so also very excited to see them, except I think I already have a conflict. So I will go watch that on the replay. Everyone, thank you so much for all the questions and comments. Amy, I want to go back to you. Any last thoughts? Anything that you want to share? If you want to go pitch where you're going to be probably very briefly in the Skellig booth, please go ahead. Please go ahead and share that.
Awesome, thank you. Yeah, so Skellig is going to actually have a booth. We're going to be at booth 31. Yes, come see our solution. Our solution actually is interactive, so you get to participate in it. But I'm going to keep it vague so it's enticing. So,
okay, I love that. I feel like Amy will have either built Enterprise C so that she can build the perfect solution, or Amy has built something so that it's every other enterprise, and Skellig isn't touching life. I mean, I'm sure you're touching the life sciences in this, but I'm personally excited to go see what that solution is going to look like, because I feel like knowing the solutions architect, the Skellig group is probably going to have gone through all of those papers and have probably figured out a couple of things with there. Amy, that is awesome. Thank you so much. Vlad, any last thoughts before we tell everyone listening thank you and sign off?
No, I think this was great. Thank you so much, Amy. Really appreciate the walkthrough.
Absolutely. Amy, thank you so much. Everyone listening with questions and not with questions, thank you guys so much for hanging out and talking about Enterprise C. A couple of Manufacturing Hub notes. Next week, we're going to go finish our technology modernization theme. We're going to go dig in on how to take industrial AI and some of these other solutions that we're talking about on the internet and go talk about what some of those pilot projects and other solutions are looking like that are being deployed today or yesterday, which is super fun and exciting. So tune in Wednesday, 4 o'clock East Coast time for that. Beyond that, Vlad and I, you guys are going to get sick and tired of watching us from ProveIt. Vlad is going to get tired and sick of talking to me also at ProveIt. But we're currently planning to have live streams on Monday, Wednesday, and Friday. So come join us as we talk with a bunch of ProveIt folks all about ProveIt and all about UNS, and bring you guys who are unable to go make it in person this year along with the ride. Having said that, again, everyone, thank you so much. This has been Manufacturing Hub, episode 247. Amy, thank you so much. We look forward to seeing you in just a few short days at this point. Hopefully, all of our ProveIt builders can get at least 45 minutes of sleep between now and then. It is going to be absolutely insane. Thank you guys so much for joining. Please remember to follow Amy and Manufacturing Hub and Vlad and myself. If you're watching on YouTube, hit that thumbs up and like button and follow along so that you can get all of the live streams. This will definitely go out in podcast format, but you guys are probably just also listening or follow us along for the live streams if you guys catch it soon. Until next week.